3. Mechanism of neuropsychiatric symptoms in CBS deficiency. The symptoms of CBS deficiency can be incredibly challenging for patients, especially when it comes to the mental health issues it triggers. At the heart of this metabolic disorder is high homocysteine, HHCY levels. This metabolic imbalance not only affects brain function, but can also lead to a range of psychiatric symptoms, including anxiety, depression, cognitive impairments, and even schizophrenia. So, why do these symptoms occur? First, let's talk about neurotoxicity. When homocysteine levels are too high, it disrupts the balance of two important neurotransmitters in the brain, glutamate and GABA. It activates a receptor called the NMDA receptor, which causes a flood of calcium ions to rush into neurons, damaging them. This overactivation, particularly in areas of the brain closely linked to memory and thinking, like the hippocampus and cortex, causes neurodegeneration, leading to cognitive and behavioral abnormalities. Next, we have oxidative stress. High homocysteine promotes the production of free radicals, damaging key cellular components like lipids, proteins, and DNA. What's worse, it depletes important antioxidants like glutathione, making the brain and blood vessels more vulnerable to oxidative damage. This, in turn, triggers neuroinflammation and causes dysfunction in neurons. Additionally, high homocysteine impacts blood vessel function. It can damage the blood vessel walls, promoting clot formation and increasing the risk of stroke and deep vein thrombosis, DVT. These vascular issues also affect the supply of blood and oxygen to the brain, leading to brain ischemia and hypoxia, which ultimately impacts cognitive function. Then there's the issue of methylation and protein modification. High homocysteine interferes with some very critical processes in the body, such as DNA modification, protein function, and the development of neurons. The result? Impaired neurodevelopment, poor myelin repair, and disrupted neural network function. All of these issues accumulate over time and eventually lead to neurodegenerative damage. Neurons lose their function and eventually die, speeding up cognitive decline, memory loss, and emotional issues. In severe cases, this can lead to symptoms like depression,